Hello friends, പുതിയൊരു വീഡിയോയിലേക്ക് എല്ലാവർക്കും സ്വാഗതം. 1000 MCQ സീരീസിന്റെ പാർട്ട് 34 വീഡിയോ ആണിത്. വീഡിയോയിലേക്ക് കടക്കാം. First question, aminophylline should not be given evening time because it may cause, the options are insomnia, somnambulism, nightmares and enuresis. And the answer is insomnia. The next question, the year in which National Rural Health Mission was launched in India. The options are 2005, 2000, 2003 and 2008. And the answer is 2005. 2005 April 12th ആണ് NRHM ലോഞ്ച് ചെയ്യുന്നത് to provide accessible, affordable and quality healthcare to the rural population, especially the vulnerable groups. The next question, the process of influencing people. The options are direction, delegation, leadership and human relations. And the answer is leadership. The next question, a code of accepted behavior based on morals. The options are ethics, conduct, standard and none of the above. And the answer is ethics. The next question, a condition of generalized ill health and malnutrition marked by weakness and emasculation. The options are anorexia, cachexia, obesity and bulimia. And the answer is cachexia. The next question, among the functions of management, the function which deals with the measurement and correction of performance of persons against the standard is, the options are organizing, controlling, directing and coordinating. And the answer is controlling. And the next question, intermittent claudation is the typical feature of, the options are coronary artery disease, peripheral vascular disease, interstitial lung disease and renal parenchymal disease. And the answer is peripheral vascular disease. Intermittent claudation means pain affecting the calf and less commonly the thigh and buttocks, that is induced by exercise and relieved by rest. The next question, common cancer of oral cavity. The options are adenocarcinoma, melanoma, squamous cell carcinoma and sarcoma. And the answer is squamous cell carcinoma. The next question, buildup of air under pressure in the pleural space interfering with the filling of the both heart and lung is called, the options are pneumothorax, tension pneumothorax, hemothorax and pneumothorax. And the answer is tension pneumothorax. The next question, the behavioral objective model of curriculum was developed by, the options are Ralph Taylor, Lawrence Stenhouse, John Dewey, Hayward Joyce. And the answer is Ralph Taylor. അപ്പോൾ ബിഹേവിയറൽ ഒബ്ജക്റ്റീവ് മോഡലിനെ പ്രൊഡക്റ്റ് മോഡലിനും ടൈലർ മോഡലിനും അറിയപ്പെടുന്നുണ്ട്. ആൻഡ് ഇറ്റ് ഈസ് വൺ ഓഫ് ദ ബെസ്റ്റ് നോൺ കരിക്കുലം മോഡൽ in 1949, introduced in 1949 by Ralph Taylor. And Ralph Taylor viewed the education as a process of changing the behavior pattern of people, using behavior in the broad sense to include thinking and feeling as well as overaction. This is all about behavioral objective model or product model. അപ്പോൾ റാൾഫ് ടൈലർ ആണ് ഇൻട്രൊഡ്യൂസ് ചെയ്തതെന്ന് ഓർക്കുക. The next question, in a diabetic patient need more than 100 unit insulin daily. It means, the options are patient is serious, patient is near to death, patient is resistant to insulin, patient is recovering fast. And the answer is patient is resistant to insulin. The next question, Which of the following drug is used to treat attention deficit hyperactivity disorder? The options are carbamazepine, levodopa, phenytoin, and methylphenidate. And the answer is methylphenidate, and it increasing the activity in the brain, particularly in areas that play a part in controlling attention and behavior. The next question, Baractant, that is lung surfactant, is given to a preterm infant who is respiratory distress syndrome by which route? The options are subcutaneous, intramuscular, intratracheal, and intradermal. And the answer is intratracheal. Baractantinte trade name ആണ് Sarvanta. The next question, mifepristone is a, the options are estrogen antagonist, progesterone antagonist, testosterone antagonist, and antihypertensive agent. And the answer is progesterone antagonist. And mifepristone is a progesterone and glucocorticoid antagonist. The next question, which of the following is the first line drug used for pain management? The options are ketamine, Acetaminophen, clonidine, and morphine. And the answer is Acetaminophen, that is paracetamol. The next question, in a 75-year-old patient who had undergone hip replacement surgery, which size of cannula is used for IV infusion? The options are 16 gauge, 18 gauge, 20 gauge, and 22 gauge. And the answer is 18 gauge. അപ്പോൾ ഡിഫറെൻറ്റ് സൈസ് ഓഫ് കാനുലാസും കളർ കോഡിങ്ങും ഫ്ലോ റേറ്റും യൂസസ് നോക്കാം. ഫസ്റ്റ് വൺ ഈസ് 14 ഗോജ്, ദാറ്റ് ഈസ് ഓറഞ്ച് കളറാണ്. ഫ്ലോ റേറ്റ് ഈസ് 240 ml/min ആൻഡ് യൂസസ് ഈസ് ട്രോമ പേഷ്യൻറ്റ്, റാപ്പിഡ് ലാർജ് വോളിയം റീപ്ലേസ്മെൻറ്റ്. ആൻഡ് സെക്കൻഡ് വൺ ഈസ് 16 ഗോജ്, ദാറ്റ് ഈസ് ഗ്രേ കളറാണ് 16 ഗോജ് വരുന്നത്. ഫ്ലോ റേറ്റ് ഈസ് 180 ml/min ആൻഡ് യൂസസ് trauma patient, major surgery, intrapartum or postpartum, GI bleeding, multiple bleed transfers, and high volume of fluids. Next 17 gauge ഉണ്ട്, ന്യൂ ഇന്നോവേഷൻ ആണ്. ദാറ്റ് ഈസ് വൈറ്റ് ഇൻ കളർ. ഫ്ലോ റേറ്റ് ഈസ് 125 ml/min, ന്യൂലി ആഡഡ് ആണ്. നെക്സ്റ്റ് വൺ ഈസ് 18 gauge, ദാറ്റ് ഈസ് ഗ്രീൻ ഇൻ കളർ. ഫ്ലോ റേറ്റ് ഈസ് 90 ml/min ആൻഡ് യൂസസ് ആർ ബ്ലഡ് പ്രൊഡക്റ്റ്, ഡെലിവറി ഓഫ് ഇറിറ്റൻറ്റ് മെഡിക്കേഷൻസ്, major surgery, and contrast study. And next one is 20 gauge, that is pink in color, 60 ml/min and general uses are general use, IV maintenance, IV antibiotic, and IV analgesia. And next one is 22 gauge, that is blue color. Flow rate is 36 ml/min and uses are small or fragile veins and cytotoxic therapy. And next one is 24 gauge, that is yellow in color. Pediatric ആൻഡിലാണ് യെല്ലോ വരുന്നത്. ഫ്ലോ റേറ്റ് ഈസ് 20 ml/min. And last one is 26 gauge, that is violet in color. Flow rate is 13 ml/min. It's also newly added. Pediatric ആൻഡിലാണ് ഓൾസോ 26 gauge വരുന്നത്. ഇത്രയാണ് കാൻല സൈസ്, കളർ കോഡിങ്, ഫ്ലോ റേറ്റ്, യൂസസ് വരുന്നത്. ഫ്ലോ റേറ്റ് കോറിലേറ്റ് ചെയ്ത് എഴുതുക, അതായത് ചെറിയ വ്യത്യാസം അങ്ങോട്ടും ഇങ്ങോട്ടും ഉണ്ടാവും. The next question, what is the chemical name of aspirin? The options are acetic salicylic acid, acetyl salicylic acid, acetone salicylic acid, and amide salicylic acid. And the answer is acetyl salicylic acid is aspirin. The next question, which of the following is long-acting insulin? The options are regular insulin, ultra lente insulin, lente insulin, and semi-lente insulin. And the answer is ultra lente insulin. Next, different types of insulin നോക്കാം. First one is rapid acting. The example are Lispro, Glulisin, and Aspart. Appearance is clear and onset of action 10 to 15 minutes. Peak at 1 to 2 hours and duration is 3 to 5 hours. And it is also called as meal coverage insulin or rescue insulin. And clear ആയിരിക്കും. 50 minutes before meal ആണ് അഡ്മിനിസ്റ്റർ ചെയ്യേണ്ടത്. Next, second one is short acting. Example is regular insulin. Clear ആയിരിക്കും. And onset of action is half to 1 hour and peak at 2 to 4 hours and last for 6 to 8 hours. And third one is intermediate acting. Example is NPH insulin, that is non-protamine hydrone and isofenum example ആണ്. It is cloudy, onset is 1 to 3 hours and peak is 5 to 8 hours and duration is up to 18 hours. And it is not related to food. And last one is slow or long acting. Example are Glargine, Ditamir and Ultra Lente. And clear ആണ്. Onset is 90 minutes and duration is up to 24 hours. 30 minutes before food ആണ് administer ചെയ്യേണ്ടത്. This is all about types of insulin. Next question, double fortified salt contain added. The options are sodium and potassium, zinc and iodine, fluorine and iodine, iron and iodine. And the answer is iron and iodine. This is a new innovation. The next question, a client after pneumonectomy will be positioned on. The options are supine position, supine and either sides, operated side or back, and high Fowler's position. And the answer is operated side or back. And the optimal position for gas exchange after pneumonectomy is a lateral position with the remaining lung in the uppermost position. അപ്പോൾ ഇത്രയാണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ വീഡിയോ ഇഷ്ടമായെങ്കിൽ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, കമൻറ്റ് ചെയ്യുക. താങ്ക് യു ഫോർ വാച്ചിങ്.